Hospital codes and overview.
In a hospital, Code Red alerts the hospital employees that there is a fire somewhere in the hospital. When you hear Code Red, do not panic. Healthcare workers are trained to deal with Code Red situations. These healthcare workers learn the acronyms RACE and PASS. RACE tells the healthcare worker how to respond when they see a Code Red. RACE stands for Rescue, Alarm, Contain, and Extinguish. By following these steps, it prevents a spread of the fire and maintains order throughout the hospital. Fire extinguishers are available on every floor of the hospital. PASS instructs hospital workers how to operate a fire extinguisher. PASS stands for Pull the pin, Aim at the base of the fire, Squeeze the trigger, and Sweep side to side. As long as healthcare workers remember these steps, the Code Red will have been successfully executed.
Code Blue in a hospital means that there is a medical emergency. Resuscitation is needed because the patient has most likely just gone into cardiac arrest or respiratory arrest. To sound a Code Blue, the staff member presses a Code Blue button located in the patient's room and along the routes of transport. The hospital dispatcher receives the alert and alerts staff members of the code by saying Code Blue, the floor, and then the room number. When a Code Blue is sounded, the nearest staff grabs the crash cart in their unit and immediately go to the room of the code. They attempt to shock the heart out of ventricular fibrillation and back to a normal rhythm, or a respiratory therapist does an emergency tracheostomy on the patient. While the crash cart is being located, CPR is done to keep blood circulating.
Code Pink alerts the hospital that there has been an infant abduction. This automatically puts the entire hospital on lockdown until the infant is located. Police are notified of this situation. To avoid a Code Pink, many security measures are taken in the nursery. All entrances in and out are locked and badges must be used to enter these areas. All of the entrances and exits in the maternity have security cameras at all times. Even parents are not permitted in the nursery. Immediately after birth, babies are given 2 identification bracelets, one identifying the infant and the other identifying the mother. Both parents have a wristband to match the babies. Before giving a child to their parent, these wristbands are checked for proper identification.
Code Green means that a patient, staff member, or visitor is involved in an altercation, either verbal or physical, and security is needed to control the situation. A Code Orange alerts healthcare workers that there has been a spill of hazardous materials and to avoid that area while proper cleanup precautions are taken.